Hello, welcome to our show, Dr. Mark Vaughn, and our special guest host, Jimmy Z.
Hi, everybody.
Jimmy Z, and if it's like an apostrophe Z, it's Jimmy's.
That's right.
Yeah,
or like sprinkles on a cupcake, Jimmy's.
Is that, I'm not familiar with that term.
It's a Midwestern term.
Oh, really?
I believe so.
Yeah, Jimmy's with the apostrophe Z is a clothing line. The little logo is a Woody, the old wagon that people put their surfboards in.
Never heard of it, but thank you, Dr. Vaughn.
Yeah,
Appreciate that.
Jimmy's. And not to be confused with Top Jimmy, the Van Halen song off of 1984.
Right, which I learned about today.
Somewhere around 1984. And, of course, we have Mr. Ed joining us.
Yo-ho.
And Holly on the computer.
How come Holly never gets her picture on this? She's the best looking one of the bunch.
She will as soon as we turn it on her, but she has to get permission.
Boy.
We're all about informed consent. You know when you're going to be on camera at the Auburn Medical Group. You know when you're going to get a shot at the Auburn Medical Group. You know when we're going to do a procedure. Yeah. And that kind of plays into some of the stuff that we're going to talk about today.
Absolutely.
Yeah. Some of you may have watched Migraine last week with Dr. Gwaine Vaughn. Well, something happened and we didn't finish. We got through describing migraine. So if you want to know all that, you have to go back and look at the first one, Migraine 1, where we talk about and describe it and some of the triggers. Now, with Jimmy, we're going to get more into treatment and prevention.
Right, so there's a whole bunch of different, like a whole slew of potential treatments depending on what you're looking for. And then so I thought what the most pertinent thing to talk about initially was treatment of the acute migraine in the acute setting, for example, when you're coming into the ER. So a lot of people, they have it really bad where this one-sided pulsatile headache, phonophobia, can't hear loud noises, hate looking at lights, and you don't know what to do. Your medication hasn't worked, and so you go into the ED, the emergency department, and you go see a physician, for example, Dr. Vaughn's old physician.
Right.
Yeah, and then so there's actually an interesting variety of different treatments that you can give in the acute setting of migraine. And they call it a migraine cocktail within the emergency department. And actually, a lot of different physicians have a bunch of different choices for what they do. So I was curious, Dr. Vaughn, when you were practicing physician in the emergency department, what you would use as your migraine cocktail, what your approach would be.
I will tell you right after we check to see what our viewers are saying.
Well, right off the bat, everybody's saying hello and hi and missed you last week.
Hello, yeah.
And Lindsay says, let's try it again. And so we're going to be doing that.
Thank you, Lindsay.
And Laura Barzyk says hi. And then Deborah Walker says, I hate migraines because of my neck problem.
Yeah.
It caused me to have migraines 2 or 3 times a week.
Oh, my goodness. Yeah, we should probably talk about somebody who's having... That'd be probably someone would give that name to, that title that you came across.
So, pardon me?
Migraineur.
Migraineur, yes. I learned a new word today, which is a person who experiences migraine, much like an entrepreneur is a migraineur.
Oh, I'd much rather be one of those than the other.
Yeah.
Okay.
I thought you were going to define migraine.
Oh,
hey,
we did that last week.
Well, you didn't. I know. I have a definition.
Oh, here we go.
Oh, please.
This is why we bring.
What do you mean? Here we go. What do you call a flock of ducks? What are they? They're not a herd. They're a flock, I guess. And a bunch of cattle would be a herd, right?
Uh-huh.
How about a classroom of unruly kids? Migraine.
Aha, nice. Very good.
Oh, thank you, Mr. Ed.
Okay.
Okay, so what I would do is usually somebody has migraine, it's been there for a while. We are now at the point where we can't use what we call the abortive medicines, which we'll talk a little bit about. So you need to attack something that's hurting the patient now. In the time when I was in the emergency department, I would use preferably IV administered compazine and Benadryl.
Okay. And so what was your reasoning for choosing those two medications?
So both of them, the Benadryl is not so much for the migraine itself as to prevent side effects from the other drug. Give me one drug to address side effects of the first drug. But you get a really good effect, and the Benadryl also is sedating anyway. So that's kind of a nice thing to be able to let somebody who has a migraine to sleep. Oftentimes they would love to be able to just fall asleep and not hurt because they're asleep.
Yeah.
Let the medicine take, effect while they're sleeping. Compazine is an old antipsychotic, works really well for a couple of things. A migraine, another one that we use a lot for is nausea.
Mm-hmm.
We don't really use it so much for an antipsychotic because there's more powerful ones and better ones for that purpose, both in the acute setting and in the chronic treatment or prevention of psychotic breaks. But it's great for migraine. So
Awesome.
I would use that. Now what I'll do, since we don't really have as much ease of setting up IV administration medicines here in the outpatient office, well, I really got to have that stop. What? Oh, is it? Okay.
we go.
Yeah, thank you. Sorry about that. Somebody's trying to call in on the on-call line. We will get to them within a half hour of their call.
Yeah.
But there's a show going on right now. So we would, or now we will certainly offer them Toradol, IM, but that's not as effective as IV in the muscle instead of in a vein through an IV.
And that's an NSAID, is that right?
That's correct. Non-steroidal anti-inflammatory drug. You can't use it on everybody, especially if they don't have normal kidney function. But the other thing that we'll do are injections. We actually have a video. There's a link in the description of a video showing us
How perfect.
resolve
To
somebody's
have thought of
migraine.
such a thing.
Yeah, with this injection of a block. I learned it at USC, the medical school down there in Los Angeles. I went to a neurology conference there once and chose a track that would train you to do this procedure where for many migraines, the nerve that's setting it off is this greater occipital nerve back here that comes out from behind the skull or under the skull, comes over the skull, and then perforates through the skull itself, the bone, to innervate blood vessels in the brain. That seems to be where the pain message is coming from.
I see.
These dilated blood vessels on the brain itself. And you can use the anesthetic right where those nerves are coming out to make a block. And you just use a large volume of the anesthetic. So even if you don't get really right on where the nerve is, you get the general area and it gets bathed in this anesthetic. It turns off the sensory impulses and takes away the pain.
Very nice.
This lasts for about 5 hours or so.
Okay.
And over that time, with no more impulses, it seems to resolve most migraines that you use it for. And we've had patients here, and as you can see on the video, patient loves it. Good effect of getting rid of the pain on that side. Also numbs up all sensation on this side of the top of the head.
So that actually kind of gets into my next question. I hope that this isn't too much of the nitty-gritty coming from my perspective, but I was just wondering,
You'll learn
in
that.
this case, I know migraines are usually one-sided.
Right.
I mean, I get them myself, and they're kind of pulsatile, one-sided. It's always on my left side of my head.
Okay.
In my case, if I came in for you to do the nerve block on me, would
Yeah.
you only block the left side, or do you do both sides?
We only do one side. And
Okay,
in fact,
that makes sense.
we'll do either the greater occipital nerve or the lesser occipital nerve. And there's even a third one on some people. But it depends on where the pain is when we're palpating back there on the back of the head, finding the exact spot. And I wouldn't do it on you because you're my student. I'm not allowed to treat you.
That is too bad.
Yeah.
Okay.
I sign a paper. They actually ask about that at the end of the rotation. So
Well,
but we
I'll have to
can
find
send
someone
you to
else.
somebody who does it, though.
Okay. Thank you very much, Dr. Vaughn.
I have a question for you. How about more powerful medication? Like when I had a heart procedure years ago, 20 years ago, I had a little discomfort, kept me awake. They shot me with Demerol. Now, that eliminated everything very nicely. And I was in dreamland for 2 days, I think.
So what was the pain that was being treated?
Well, I don't know. I was just in discomfort after the heart procedure.
Okay. So
So
pain from something being cut open and
Yes.
pulled apart. Yeah. And opiates are used for that kind of, that's what Demerol is. Although we don't really use Demerol anymore. It's got a lot of bad things associated with it, so we don't really make use of it. But we used to use it all the time. Every shift in the emergency department, I used to use Demerol. Every single shift would use it for things. We don't use it for headache pain or for migraine pain, though, because it's just not that good of a medicine for it. What you end up getting is people who keep coming back for the Demerol, not getting good relief of a real migraine or something like that. So
It did send me off into Never Land. It was,
and you don't have to do that to get rid of migraine. In fact, opiates are recommended against being used for that type of pain now. So we'll use other pains, other medicines, like the ones that we described, for treatment of an acute attack. Were there any other medicines for treatment of the acute pain that we didn't cover? We didn't talk about the abortive medicines.
Right.
And what that's all about.
Which are sort of separate from the medications that you would give in the emergency department. I mean, I remember one attending had mentioned using magnesium, IV magnesium, for some reason or another in the treatment, as part of their cocktail. But that was only one attending out of several that I followed.
It's listed, and when you read the literature on how to treat an acute migraine in the emergency department, magnesium is one of the things that you'll see listed as a potential medicine, not nearly as effective as things like Reglan, which is similar to the Compazine that I used to use.
Yeah, similar mechanism, I think. So, okay. So should we move on to maybe abortive medication?
Yeah, what's this whole thing about abortive? So have you learned about the different stages of migraine and the different chemical environments in the brain, this process of it changing over time?
Yeah, I think that I had read that there are 4 stages or so.
Do you remember?
I wouldn't be able to list them off. I know one of them is aura.
Yeah.
And that only about 25% of people with migraines actually experience an aura. But I do remember reading something about that. So
each of these stages, like the aura, there is something different going on in the brain. Different neurotransmitters are being released by nerves inside of a part of the brain or parts of the brain. As it changes, different medicines will work. And so early on, when somebody is just first getting it, before it's established, and I'm just guessing because I don't remember how long this is. It's like on the scale of 20 or 30 minutes.
Okay.
That you want to get it in, maybe an hour. You can use medicines like the triptans, sumatriptan. I'm trying to remember some brand names here. Maxalt is a brand name of a triptan. Rizatriptan is another generic name. Sumatriptan was called, can't come up with the brand names. And you don't know brand names because they teach you all the generics.
I don't know brand names, nope.
But these are medicines that originally would be, the patients would inject themselves. They'd carry around a little injector and give themselves a shot, feel this pain like they're having a heart attack, and then the headache goes away. And it was really worth getting that pain to have the head. But they do act on blood vessels and even blood vessels of the heart. So there is risk to use them, especially in somebody who's had a history of some kind of procedure done on their heart.
And it can also cause interesting vasoconstrictive side effects. For example, it make your fingers turn white, and something that's called Raynaud's
constricting the blood vessels.
Phenomenon. Exactly. Yeah. And so.
Yeah, that's what we want to do, because the idea is that the dilation of the blood vessels in that part of the brain we were talking about earlier is the cause of the sensation of pain. People argue against that, though, that that's not actually what's causing the pain. It's a bit controversial what it is, and they're still learning. Yeah. So those are the abortive medicines.
Yeah, and then so alongside that, you have the NSAIDs, which we kind of referred to previously in the discussion of use of Toradol. And then on top of that, you have these sort of newer generation of medications called the Gepants, I think, and the Dietons. And so the Gepants, in some examples of those would be Nurtec and Ubrelvy. Those are actually not the generic names; those are the trade names.
Okay. So some people may be seeing TV commercials for these, I would guess, at this time.
Most likely.
I haven't seen it myself, but I'm guessing based on the timing. These medicines were just being discussed when I did this conference 3-4 years ago. And they were saying the studies are showing that these are effective, and they're being submitted to the FDA, and they're going to be exciting when they come out. Well, now they're out.
Yeah.
And it is exciting that people can use them to get rid of the thing that's also surprising, but not in a good ways, the cost. Just like any of these great new drugs for a set of patients who really need a better new treatment, it costs an arm and a leg to use it.
Yeah, these days, since there's such new medications.
Yeah.
Here's a guy that's trying to add his 2 cents to the discussion here.
Yeah.
Oh,
His name is Gwaine
did
Blond.
you see that?
Sorry, I'm not there this week.
Ignore Gwaine. We got a super chat from Laura.
Oh, okay. I have no idea what that means.
She supports our Dutch Brothers Have It.
Oh yeah, you
Thank you very much, Laura.
Yes, thank you, Laura.
But hey, Gwaine is saying, "Sorry, I'm not here." Okay.
Oh, like there he is. There's his picture on the screen. Right there. Oh, I can't cover it up with my finger. Oh. Okay. Yes, Dr. Gwaine, we miss you. And look, Jimmy's filling in your seat.
Had to lower the camera. So
we
we'll
tilted
pick
the
it
camera,
back up
so-
for you.
Looks
before
like you
come
found
back.
a good replacement for me. Okay.
Oh, no. Just, he's doing a good job, yes, but
Okay.
no replacement for the Dr. Gawain.
Mm-hmm.
But we do love you and miss you, and of course the audience is enjoying Jimmy, but they miss you. All right, back to Laura, though. Laura, did she write something with her super chat? What did
Years
she
ago, a
write there?
doctor told me to drink caffeine when I first started to get a migraine. That never really worked for me, as I used to get 1 to 2 a week.
Oh, my goodness. Yeah, let's look at our picture of a source of caffeine, possibly, for migraine treatment. There we go. And if you look real carefully, you'll see Dr. Gawain down there looking at something. I don't know what it is he's looking at there. Maybe something to buy for his kids when he goes home, but there's a potential help. I call it an adjuvant. An adjuvant being something that you use with treatment. So thankfully, I've experienced what you would actually call a migraine very few times, but anytime I have a headache that's coming on, I will use a treatment of the NSAID. Specifically, I like Aleve or naproxen, Tylenol, and caffeine. And with that combination, you're going to knock it out. But you were talking about not using all three medicines at once.
Simultaneously, that's right. So
Now, why would you not do that?
So I was told that by a specific emergency medicine doctor that it's helpful, instead of giving a shotgun blast of all of the medications that you know how to treat migraine with, instead using a stepwise sort of approach, because you don't want to, in the case that you give them everything and it doesn't work, you have nothing else to turn to. And then patients will hate you in that case. And then so instead, number one, you buy time. And number two,
Yes.
every new medication you add, you are potentially assisted by the placebo effect. So even just somebody giving you a sugar pill could potentially cure your migraine, because just the fact that you think something is being done for yourself can help with your treatment.
As crazy as it sounds, placebo works. Some people estimate 30 to 40% of the time.
Yeah.
Your listener, Evie, says
Evie?
that she takes sumatriptan,
Sumatriptan. Yes, that's the name I couldn't come up with.
and the quicker she takes it, the quicker it works.
There you go. That whole idea of abortive, you have to get it in before the migraine evolves to another state, another biochemical state in the brain. And at that point, the triptans don't work anymore. You're going to have to use something else. And that's where these new medicines are helpful, because
And you
they
cut it
do
off
work
early.
in that
Yeah, absolutely.
that state, that advanced state of pain.
And you were mentioning sort of like a chemical milieu in your
Yes.
brain, all these different vasoactive neuropeptides.
Yes.
I actually have a list of a couple of them here, actually two. So we'll be here for a while. Substance P is one of them,
Yeah.
and then also calcitonin gene-related peptide, which both of those they believe are implicated in creating
CGRP.
CGRP, that's right. And then so both of those are implicated in sort of causing the symptoms of migraine. And so these new medications, the ones that'll cost you an arm and a leg, the Gepants and the Dietons, are actually sort of related to, actually more so the Gepants, are related to helping inhibit the activity, stopping the activity of those calcitonin gene-related peptide, that molecule. They're actually called CGRP receptor antagonists.
So once the cat's out of the bag, you've reached that point, these are able to herd the cats,
Yeah.
unlike any medicines that we had before. So that's what's so exciting about it. That's why when I heard about these medicines, I was excited about what we had for people with migraines. I don't know how they're going to get it because it costs so much, but
Yeah.
you know, in 12 years or whatever, whenever these medicines go generic.
Jennifer Martinez says, I take Virocet that has caffeine in it. Works well.
Okay. Yeah, a lot of caffeinated products are out there. You know, you could just get Dutch Brothers or make your own coffee, or Mountain Dew or a couple of Cokes or whatever,
Or have someone give you a sugar pill.
but instead of a caffeinated sugar pill.
Yeah.
I love that idea of spacing out the medicines so you have more time for the first one to work or for the second one to work, and then you get a little bit more placebo effect with each one, maybe. Of course, I haven't read to see if there's any studies that show that is a real thing, that you
True.
get placebo effect with the second one that you didn't have with the first one. I don't know.
Yeah, that's
I
an
think it
interesting
depends on how you
concept.
present it.
Yeah, fair.
Yeah.
Edna Vogel.
She is one of our people on Patreon.
When I have a migraine develop, I am prescribed taking promethazine with a prescription dose of naproxen sodium.
Mm-hmm.
I found that it works very well for me after it is started.
Yeah, that promethazine is really similar. Can we get her comment on the screen? It's not showing. Okay. Oh, because not all of them come through. Promethazine is really similar to compazine, that medicine I was talking about earlier. In the studies, the compazine works a little bit better. And that's when it's given by an IV, which you do in the emergency department because you can. Because it's been shown to be more effective than either IM or a pill by mouth.
So, since we've gone over almost all of the abortive medications, at least that I'm aware of.
And the new ones, too.
And the new ones.
Yeah.
Are there any others that you wanted to add to the list before we go to migraine prevention?
No.
Okay.
Yeah, let's talk about prevention.
So, other than number one, avoiding potential triggers, because I think last week you discussed that there are some people that have triggers. Some people mentioned caffeine, chocolate.
I don't know if caffeine's a trigger, is it?
I think in both potentially causing migraines and also in treating migraines, interestingly.
Certainly
caffeine.
chocolate, yeah.
Yeah. So also, what was this one? MSG. MSG that can be found in certain foods apparently can be a
Chinese food restaurant, yeah.
So number one, avoid those triggers if you're able to discover them as far as prevention. But there's also a good number of medications that you can use for prevention in addition to that. I think first line is beta blockers.
Yep.
Which are propranolol.
Very common.
Is an example of. And those are medications that have a whole bunch of different uses, one of which is slowing down your heart rate for various reasons, if you need to do that, and for migraine prophylaxis,
blood
a fancy
pressure
word.
control.
Blood pressure control.
Yeah.
We use that a lot.
Generic, very available medicine that we use for lots of things. Tremor, sometimes we'll use it for that if you have tremor.
We have another listener here, Ingrid from Berlin, Germany.
Wow.
Oh, Ingrid Janicki, has she been here before?
I don't recall. But Ingrid, we're glad to have your comment. What's she saying?
That's it, just saying hi.
Oh, greetings. Okay, thank you.
Guten Tag.
Yeah, it's something. How many people are watching from different countries? And it's probably pretty late there now.
Yeah. Guten Ivan.
We don't know what he's saying.
Yeah, it's
Hope it's
unregulated.
I hope it's nice.
And then there's, in addition to that, anti-epileptics, meaning anti-seizure drugs, one of which is topiramate.
Yeah.
That you can also use.
I've seen that some of our patients are put on that by neurologists before they continue to have them. Yeah.
A class of drugs called tricyclic antidepressants. Very useful in the treatment of depression as well. However, I think that side effects are often prohibitive in their...
That's why they're not used so much for that anymore, but used a lot for migraine, used for IBS or irritable bowel syndrome, used for... did I say insomnia? I didn't say that already. These would be things like amitriptyline, imitriptyline, protriptyline.
Yeah. And then Botox, which I thought was a very interesting option. So, and Botox, actually, it can only be used in the setting of chronic migraine. And that requires that you have had at least 3 months of having a migraine for greater than or equal to 15 days out of each month. So you have to be you have to be in a pretty bad shape to warrant using Botox. And then I've actually seen it administered by a neurologist in one of my previous rotations. Have you ever seen it done before, Doc? It's like
I've not seen it, no.
It's like a very sort of methodical and precise injection, and I think something between 15 and 20 sites on your forehead, above your eyes, the temporal muscle, and then in the back in 3 places on either side, and then in the traps as well. It's a pretty interesting procedure.
And if too much was given, the person looks like this.
Yeah, exactly.
For weeks.
Gotta be careful because that Botox actually comes from, it's botulinum toxin. It comes from tetanus. Clostridium botulinum.
Yeah, not tetanus, but the other one.
Yeah. Which...
And the way it kills
into your
people
muscle.
when they get botulism is they get paralyzed so they can't breathe. Yeah.
I hate when that happens.
So you're on purpose injecting botulinum toxin into a person's body, but it's used correctly. It'll loosen up these muscles. It makes the wrinkles go away. That's why it's used for cosmetic purposes. Yeah.
Jennifer Martinez was asking about Botox injections.
Jennifer
and
is our
she's-
latest Patreon member.
She says, thank you for the info, you guys.
Well, thank you for being on Patreon. And anybody who wants to know about this Patreon thing, there'll be something in this part of the screen at the end. You'll see all the names, and it'll show you the link. Okay.
The last one that I have here is the anti-CGRP medications. Those same ones that we discussed, the
new
same
ones.
class. Yeah, those new ones that we discussed in the abortive medications can also be used for long-term prophylaxis or prevention of migraines.
Yeah.
So that's what I got.
I'm
Doc.
looking forward to when they're not generic, or when they're generic and not brand name anymore.
Yeah.
Okay. Any other comments or questions there?
No, that's the last one from
Laura
Jennifer.
Barzyk, super chat. We want to recognize you again. We like that.
So at the point of migraine, at the point where you start smelling colors and tasting sunlight, it's too late, huh?
I think
For some of the medications.
I think you're confusing it with the brown acid.
Oh no.
I would think. I can remember that. Tasting anything but what was right. And it
When you were licking the stickers?
No. When I had my headaches,
Oh, okay.
I could smell colors. I could taste sunlight. Everything was
Oh,
crazy.
interesting.
And then it went away.
What's it called? Synesthesia?
Yeah, synesthesia. That's like
Insanity,
Is it part of
maybe?
migraine, or is it just...
I have no idea. You might be
LSD.
dealing with something else, some synesthesia over
Oh,
there.
maybe, well, if it happened again, I'll be right here.
Was this in the 60s?
No. This was probably 10 years ago, 20 years ago.
Oh wow.
All right.
Okay.
Well, we may have to look into that further. Thank you for joining. Then thank you, Jimmy, for filling in for big shoes to fill.
And big shoes and
Big shoes.
a lot of headroom.
Big
so
shoes. Big. I mean, they are big. I've seen them.
Is Big Shoes going to be here next week?
No.
Hi, Jim.
No,
You're going to have a
this-
regular
this-
place
hey,
here
this
pretty
is a
soon.
two-week
this
thing.
could be a regular
Next,
thing.
now, Mr. Ed likes to know what we're going to talk about, and I'm very poor at planning ahead the topics of the shows, but we have a topic for next week.
Ooh.
And you know where I got it?
I have no idea.
The gas station pump.
I should have guessed.
Because when I was pumping the gas, Maria Menounos was telling me that some percentage of Americans are deficient in 3 vitamins. And since that's very different from any information I'd actually gone over and seen, I wondered about that. So we're gonna go over that. So those of you who don't know Maria Menounos, she's the one who talks at you before the movie starts.
I don't know any.
Or before you start pumping gas, evidently.
Yeah.
And before you pump gas, she also talks to you there, telling you that people are vitamin deficient in America. So we will go over that. We will go over common vitamin deficiencies and what to do about it, or if, and how to find out. We will talk about all that next week. So I'll tell you in advance, because
Perfect.
you might get this job again. And we'll see. We'll see what the response is. If they love you,
Yeah.
we'll invite you back.
Oh, excellent.
But-
Please.
But as somebody filling in and being a host on the show, we give you an Auburn Medical Group mug
You are so lucky.
that has the logo on
Ed
one
hasn't gotten
side.
him yet. Gaze yet, huh?
Yes, I did. Yes.
Oh, you did?
Oh,
Okay.
yeah. I feel so fortunate.
And on the back, it has a picture of Dr. Mark and Dr. Gawain that you can smile at and gaze at
I am very
as you
honored.
drink your Dutch Brothers.
Thank you so much. Very
Thanks
kind of
for
you.
filling in.
Oh yeah, it was my pleasure.
Oh, I just drank out of that, so we probably should clean it.
Oh, okay.
Get him one.
Okay.
Get him
So-
one in the box.
And you didn't want to share your socials. You're a private guy.
No, I don't exist.
They don't know
I
what your
don't
last
exist.
name is.
They have no idea.
They think you're a pair of shorts from the 80s, the Jimmy's. I used to call them Jimmy Z's, but they're Jimmy's. It's apostrophe Z, so apostrophe S. Yeah. Have any of you ever seen Jimmy's?
Yes, I know.
You know what Jimmy's are? Okay,
I
because
know
you're
what
from
you're
that
talking
culture.
Ed.
Yeah, and you know the
Always
Woody
counts
is with
on
the
him.
surfboard. Yeah. Okay, so until next time, all of us telling you to stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.